This week, we're honoring our nation's veterans in our series, Those Who Serve. Tonight, the millions who have suffered from post-traumatic stress disorder. Cynthia McFadden on the intensive therapy that's working in Los Angeles, Chicago, Atlanta, and Boston, where veterans can receive life-altering, sometimes life-saving treatment.
For nearly 15 years, Blair Morin served as a military medic, including on the front lines in Afghanistan.
Lost a lot of friends fighting for pieces of property.
He says the withdrawal was hard to watch.
The guys that I couldn't bring home, I carry them with me.
Still?
Still.
Blair himself suffered a traumatic brain injury and started experiencing PTSD.
When you talked to your commanding officer, what did he say to you when you said you thought you might have PTSD?
I was actually told that PTSD is not a real thing. I felt like I was digging into a hole and I was yelling for help, and instead of throwing a rope, I had dirt kicked down on me.
At his lowest point, Blair says he got a glimmer of hope at a veterans fundraiser at Fenway Park.
Another veteran got up and he was telling his story. He actually said when he decided to reach out was when he had decided to take his own life. I was there.
You had had those thoughts too?
It was a step further. I had a plan.
Blair was about to become part of a staggering statistic: the 30,000 post-9/11 vets and service members who have died by suicide, 4 times the number who died in combat. But the vet who spoke at the fundraiser that day spoke about a sort of mental health boot camp, where it said veterans can get more hours of therapy in 2 weeks than they would in a year. It's at a place called Home Base, and it's free, funded by the Wounded Warrior Project and run by Mass General. Blair enrolled.
From morning to night, their job is to recover. Rather than waiting 7 more days for the next 15-minute session, they're able to apply in real time what they've learned for the life that lives outside of these 2 weeks.
Dr. Louis Chow is a clinical psychologist who helps run the program.
There is this incredibly powerful belief that I didn't do enough, I failed, I should have done more. And that gets echoed hundreds, thousands, tens of thousands of times.
That was the case for Sergio Alfaro, an Iraq veteran who came to Home Base 5 years ago. Sergio was admitted to Harvard Medical School when he got home, but his PTSD got in the way.
It's like all these things that everybody is able to do made me start thinking about these very disturbing things that happened over there. You know, either incoming, mortar explosions or RPGs blowing up. I think that's one of the best things about the group therapy was the fact that I was able to engage with other veterans to kind of see what they were going through, to not feel so alone.
What do you think life would have been like if you hadn't found your way here? Hey, it's okay. It's okay.
I wouldn't be alive right now.
Blair said the same.
I'd be huddled up in my basement, avoiding life. My children wouldn't have a father. My wife would be a single mother. Worst case, I just wouldn't be here.
His advice for other veterans who are struggling right now?
You didn't do this alone in the military. You're not doing it alone now. Reach out.
Cynthia McFadden, NBC News, Boston.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.